quest continues. Live from the Wood TV Art Prize studio at the Grand Rapids Art Museum.
We're so excited today to have Dr. Bradley Bengtson from the Bengtson Center for Plastic Surgery here to talk about breast surgery options and a couple of exciting upcoming events.
Dr. Bengtson, how do you approach patients for breast surgery differently than other plastic surgeons around? Because we know there are a lot of people doing it,
Sure.
but that you really stand out.
Yeah, it's a good question. So we kind of approach patients individually and uniquely, and we have this really cool assessment system that, along with just a basic physical exam, we can actually document different sizes, mainly the width of the breast, elasticity of the breast, and then really find the implant that really fits each individual patient, because really the best plastic surgeries in patients you can't tell have had it, right? I mean, at least from our approach, and certainly in West Michigan. So it's all really about restoring the natural volume of the breast back.
And you talk about expectations, managing expectations,
Right.
making sure that what I think is a C cup is what you think is a C cup, and then the patient gets what they expect.
Yeah.
And this technology allows you to really do that.
Yeah, it's really neat. In fact, it's interesting you brought that up. We just actually submitted the first research project to do something seemingly simple, is to standardize bra cup sizing. So with just one hemicircumference measurement of the breast, we have really defined a way to standardize the bra cup. So we're going to integrate that into the measurement system and those sorts of things that we see. But with Vector, it really gives us, the patient, really the idea of expectation, because once you get past cost and safety, it really comes down to what am I going to look like. And looking at other before and after photographs or trying to stuff an implant into a bra or something just doesn't really define it. So this technology is the real deal.
Yeah, it's very rare that you can see an after on yourself before it even happens.
Exactly right.
Let's talk a little bit about safety, because we know in years past there's been a lot of concern with women, and technology has changed in that area as well, of what implants are actually made of.
Yeah, that's a great point. So basically every disease a woman can get is the same, whether or not they have a silicone breast implant or no implant. So it's not going to increase your risk of developing any medical, diseases or problems or anything like that in your lifetime. And there's some new designs of implants. So some people refer to it as a gummy bear implant. So with a gummy bear, if you cut the head off, the guts don't come out, right? So it's kind of like that, where you can actually transect this implant, and the gel is thick enough that it kind of stays within the shell. So there's some major advancements, kind of coming along the line. I've been able to see some of the new and future devices that are coming too, and it's real exciting. A lot of really interesting things coming.
I know you've been involved in this on the forefront for many, many years, and really helping to listen to what your patients say they want and they need to make the best lifestyle choices. And you talk about that with a special new kind of bra as well, the She-Fit. Tell us about that.
So we've actually designed a couple different bras, post-surgical garments, with some different manufacturers, because what we were finding is that the post-surgical garments were doing the opposite of what we wanted. They're actually lifting the breast or putting pressure on the incision line. So we designed some bras to kind of go against that, and also kind of builds into this fast-track recovery program that we have. I think one of the biggest misconceptions about first-time breast surgery is that you need a long time to recover and all that. If you do the surgery very precisely, I don't like to see one drop of blood. There's no trauma to the pocket or to the ribs or anything like that. We have the patients actually start stretching, moving their arms above their head, starting right in the recovery room. We want them to go home, take a nap for a few hours, and then come down to Art Prize. We want them to go out to dinner.
That's pretty amazing.
Go out to their kids' soccer games. I mean,
Right.
that's the level of quality and recovery where we are today.
Right.
So I was partnering with this Sarah, who I think was in studio. It would be nice to capture some of her energy. I mean, she's like one of the most energetic people I've ever seen, but she's designed this really cool, it's really more of a sports bra. So after they have transitioned through the post-surgical garment, there's really no great bra that you can actually get patients into that actually is supportive without being too restrictive. So She-Fit is a really nice innovation. I think it's really going to take off.
Yeah, if people want to learn more about any of the things that we talked about, you actually have an event this week.
Right.
It's a seminar of sorts. It really educates people who may be thinking about surgery of the sort.
Right. So you can come and get all your questions answered. This Thursday night, we have a special breast focus seminar coming. And I think we're actually auctioning off your Beamer this Tuesday.
Something like that, yeah. That'll for sure get people to line up around the block.
Don't come just because of that, right?
No, yeah. But that is a great point, because Dr. Bengtson has such a great personality, and we have attended these in the past, and it is really a great way to get the information in a fun but informative environment.
Exactly,
Your fall event in November is so fun, because you bring people just from all kinds, whether it's skincare or Botox or radius or, and people interested in surgery and weight reduction. That's a fun event. And that's on November 6th.
November 6th, yeah. So I think we'll probably be back in the studio promoting that before, but definitely it's really going to be a fun night. Have usually 500-600 people come through.
Yeah, and you always have really great food, which we appreciate.
Food, great food, a lot of fun partners and everything with that.
It is really great, and of course we'll get all the information on our website about how you can contact Dr. Bengtson and his staff, because they do a remarkable job. Thank you so much.
Thanks for having me.
We'll be right back.